Thank you again for being promptly back. We're now into our next session, which is going to look at some of government policies led by the departments, and also some of the statutory providers of the various services here. So I'm glad that we're joined on our panel just now to introduce them all in advance. Firstly, Siobhan McArdle, who's the Assistant Secretary in the Department of Health, with responsibility in this area and others as well. Professor Eamon Keenan, who's National Clinical Lead for the HSE related to addiction services. Assistant Commissioner Justin Kelly is organising serious crimes within the Garda Síochána, and Ben Ryan, who's Assistant Secretary in Criminal Justice Policy in the Department of Justice. Now again, I know this is a very short time for all the presenters, 10 minutes each, because this is really big policy stuff and big service delivery stuff. And in a way, we won't do, excuse the pun, we won't do justice to all of the presenters and the detail that they want to present to us. But again, we will be going deeper on various aspects of all of this again. First session this weekend is to give you a broad brush across a lot of areas. So again, I'll ask the presenters to really work with me, which they've all done to date, which is just to really manage the 10 minutes time, and we will give you a 1 minute warning before the podium self-explodes and time is up. So first, if I can call on Siobhan McArdle, Assistant Secretary, Department of Health, please.
Well, good morning, everyone. As introduced by Paul, I'm Siobhan McArdle, Assistant Secretary in the Department of Health, with responsibility for drugs policy, among other policy briefs. I really welcome the establishment of the Citizens' Assembly on Drug Use. It's a privilege as a policy maker to participate in this topic of drug use that has been chosen for the Citizens' Assembly. My brief is to outline for you the dynamic policy approach to drug use in Ireland and to highlight the new priorities we have for the National Drug Strategy. The Department of Health has an open and inclusive approach to drugs policy. We have a strong tradition of involving people who use drugs, their families and communities, and civil societal organisations in the policy-making process. I want to acknowledge the powerful testimony on the lived experience of drug use at yesterday's session. Many of those who spoke are actively participating in the development and implementation of drugs policy. I very much look forward to the recommendations of the Citizens' Assembly on the future direction of drugs policy in Ireland. Drugs policy and drugs use is a societal issue, one that affects all members of society, whether directly or indirectly, and imposes very significant social and financial costs. I want to briefly present some statistics which will show the societal impact. In 2020, 7% of the population used drugs in that past year. This is equivalent to 290,000 people aged 15 years or more. It's a snapshot of drug use in one particular year, and it does not reflect actually the frequency of drug use. In 2021, the most recent full-year treatment figures for that period show that there were 4,206 new presentations for drug treatment, up from 3,802 in the previous year. Sadly, Ireland has had 235 drug-induced deaths among adults in 2017. The trends in drug-induced deaths since 2011 are stable, but with a slight increase of about 4% in that period. In 2021, health expenditure on drug use was €145 million. This expenditure includes funding spent by the Department of Health, HSE services, community-based services, and the Health Research Board. This figure does not include additional funding for drug services in recent budgets, which amount to an increase of approximately €20 million. It is estimated that there is a societal impact or cost of drug use equivalent to €650 million. This includes costs to hospitals, prisons, the criminal justice system, and addressing the medical and legal consequences of drug use, along with the productivity losses associated with drug use. I want to outline for you the policy response to drug use as set out in our National Drug Strategy, Reducing Harm, Supporting Recovery. The National Drug Strategy sets out a health-led approach to drug use. The strategy is cross-cutting policy involving the input of the statutory and community and voluntary sectors in order to provide a coordinated response to drug use. The strategy was informed by the views of over 3,000 individuals and organisations. It is overseen by a national oversight committee involving government departments, state agencies and civil society, and it is led by the Minister of State, currently Minister Nocton. The national strategy is also supported by international cooperation, including the EU Drug Strategy and Action Plan and the British-Irish Council Work Sector on Drugs and Alcohol. There are a number of key principles underpinning a health-led approach to drug use, principles including person-centred care, and the strategy sets out a person-centred care approach to drug use with addiction treated first and foremost as a health issue. Compassion is very central to the work we do. We need to meet people where they are and develop integrated care pathways for high-risk drug users, including people who are homeless, offenders and injecting drug users, in order to achieve better health outcomes. This requires integrated care pathways to deliver the best outcomes for people that connect care settings between GPs, primary and community care providers, community specialist teams and hospital-based specialists. It is vital also that we understand and incorporate the social determinants of drug use, understanding that there are underlying social and economic determinants that increase the prevalence of problematic drug and alcohol use in certain communities. These issues require action across government to promote community development and community safety. Partnership is a central tenet, requiring input and commitment from a wide array of government departments, state agencies and members of civil society in order to achieve these goals. Evidence is really important, as presented in the earlier session. Our strategy is informed by national and international evidence and good practice. It takes into account the views of an expert panel chaired by Paul Griffiths from the European Drugs Agency. The policy itself was launched in 2017 and covers the years 2017 to 2025. We conducted a mid-year review in 2021 to ensure that we could assess and monitor the progress in delivering the 60 actions in the first phase of the strategy. This review is available online and we'll share that link with colleagues here. The review found significant progress had been made on the majority of actions. Also from the review, we identified 6 strategic priorities for the remaining period of the strategy. And these are set out here. And each of these has associated actions, and I'm just going to highlight some of the key actions through the next few slides. So one of the key strategic priorities is to focus on the prevention of drug use and harms among children and young people. Prevention and education of drug use among younger people is a key pillar. The Department of Health has made a 1.5 million allocation for a 3-year drug and alcohol prevention and education programme. It aims to strengthen the prevention of drug and alcohol use and the related harm among children and young people, focusing on a range of different settings. This programme will utilise evidence on best practice throughout Europe, which will help to professionalise drug prevention practice in Ireland. Another key strategic objective is to improve access to drug services in the community. In 2022, the Department of Health and the HSE provided over €30 million of funding to 280 community-based drug and alcohol projects through the local and regional drug and alcohol task forces. This supports the implementation of the drug strategy, and an additional funding over the last year was provided to address a number of specific targeted actions within that. For instance, in 2022, €850,000 was allocated for a HSE-led initiative to reduce the harms of cocaine and crack cocaine. Drugs do not impact on all people and communities in the same way. The National Drug Strategy recognises that the impact of drug use is greater in disadvantaged communities. To address this pattern, the Department supports a network of drug and alcohol task forces to prioritise the impact of drug use in these disadvantaged communities. There is also a strong overlap between homelessness among single people and drug use, and our strategy aims to address this. Key element in the strategy is to take a holistic approach to recovery. Recovery is an essential part of drugs policy. This means recognising that people affected by drugs have complex health and social needs that require a sustained and comprehensive response. It also includes action to address the social determinants of drug use. Okay. And one of the other elements that my colleagues Eamon and Ben will focus on is our diversion to health services. So our Irish model focuses on a health diversion pathway, a health-led approach for people in possession of drugs for personal use. And just finally, we also focus on the public health legal framework for drug use. So the Misuse of Drugs Act is used as a framework to establish a system of control on certain drugs to protect the public from dangerous or potentially dangerous and harmful substances. The Act has been updated in subsequent years to address issues like the Medical Cannabis Access Programme and the Supervised Injection Facility, which is being currently established. And I think I'm out of time now.
Thank you, Siobhan. Really good. Thank you very much.